Okay. All right, you're good?
Yeah.
And I'll just cut this stuff out.
I think it's fine. I think I'm like there's fine.
Yeah.
Oh, you mean like this part?
Mhm.
Yeah.
Yeah, the prep part. Okay. Hi, everyone. I'm Dr. Mica Riley. Welcome to our ACL community. This platform was created by the Movement, Rehab, and Performance team to educate, empower, and improve the outcomes of all ACLers. Okay, so today we're going to get into a topic of frequently asked questions. I've got my colleague here, Dr. Sam Watkins. And we're just going to go through a bunch of frequently asked questions that we get either through social media or in person here in the clinic. So here's Sam.
Yeah. Hey guys, like Mica said, Dr. Sam Watkins, also Doctor of Physical Therapy and Strength Coach, and one of the owners of Movement. And this is a pre-launch webinar. So if you are joining with us live, you're one of the few that signed up before launch. Welcome. Thank you. In the future for these live streams, we will be having time for your question and answer. We want to make sure that you have access to us and aren't just trolling the internet for answers that are hard to come by. So make sure to tune in the future and you can ask your questions. But today we're just going to be answering questions that we commonly get. So let's jump into it. And one of the main questions, one of the big questions we get often is, should I have PT before surgery? And I'll let Mica, just curious what you would say there.
Yeah, absolutely. As you probably already know, I mean, I would say yes, absolutely. The biggest thing is we think about what happens with an injury. There's just a lot of trauma in general. Knee swelling, knee pain, lack of range of motion, you're not functioning to your best ability. And so a lot of that in terms of the research, if you go in not looking very good, you're probably going to come out of surgery not having the greatest outcome. And so the biggest thing we want to make sure is that you are as normal as possible going into surgery. That way you can optimize your outcome out of surgery after surgery. Yeah, so do you want to get into the details about what we look for?
Yeah, absolutely. Yeah, so there's a number of things. I think that one of the ways I like to think about this whole process is, you have your injury, which is going to result in muscle atrophy. It's going to result in swelling, range of motion issues. It's going to be painful. That happens right after the injury. And there's also this kind of similar to what it looks like after surgery as well. And rehab is basically about digging or getting ourselves out of the hole that we've kind of dug ourselves in terms of strength, range of motion, etc. We're trying to get out of the hole that we've dug, right? And that's how we get back to sport. And pre-surgery, we're looking to try to normalize strength as much as possible, trying to normalize range of motion, trying to get you feeling pretty good before surgery, right? The less of a deficit that you go into surgery with, the less of a hole we're having to dig ourselves out of. So it just makes the process much smoother. And we're looking to get at least 80% quad strength, ideally more, the more the better. Because again, we're just going to have to build all that back up anyways. We're trying to get full range of motion, both extension and flexion. You should be walking pretty normally. Minimal limp would be ideal. Manage swelling, manage pain, all of those things, so that when you go into surgery, we're not having to deal with already having major deficits that are going to be then compounded by the trauma of surgery. Does that all make sense, Mica?
Yeah, I would add on, I like to always tell people, you honestly should show up on surgery day looking like you don't need surgery at all. So, and it kind of, that's just what you generally should look like. Feel good about all the work that you put in going into surgery.
Yeah. I 100% agree. And it's kind of a weird situation sometimes where you might not even feel like you need surgery. Right? If people do really well in their preoperative rehab, they're kind of living their daily life. They're lifting weights, they're getting strong again. And people should be feeling pretty good after 4 to 6 weeks of prehab. And it's like, oh, why am I going into the surgery? It's still needed. You still should have it. But the more that you feel like you're questioning needing it, the better off you are. Yeah. Right.
Absolutely. What's our next question?
Let's see, we got plenty on the list here. We get asked all sorts of different questions. Let's get into graft types. So people will ask, they're coming in for prehab, maybe they haven't quite decided on their surgery date with the surgeon yet. And they're wondering, what graft should I get? Want to dive into that, Mica? You
Yeah.
got some personal experience there, yeah.
Yeah, I mean, there's just a lot of options. You could either decide to choose from your own tissue, which is an autograft, or you can decide to choose from a donor tissue, which is an allograft. And both are good options in terms of it all depends on where you are at in your age group and what kind of activities you like to do and what you're just at the end of the day wanting to get back to. But within those two types, you can steal from certain tendons like the patellar tendon, the quad tendon, the hamstring tendon. So those are the main ones. But like if you do a donor tissue, they'll steal tissue from wherever, and it could be sometimes the calf, it could be like your Achilles, it could be just a bunch of other places too, but also those same ones that we previously mentioned with the hamstring, quad, and the patellar tendon. So it all just depends with those. Biggest thing here I like to hone in with people is that you have a choice. Just because the surgeon says that's what they would do or what they think is best for you, you just take those, whatever the surgeon brings to the table, and piece it to your body and figure out, does this match up with what I want to do? I tell people there's honestly, unless you're somebody who's really young and very active, I would definitely say don't do a donor tissue, just because the viability of this tissue lasting as long as you want it to through your lifespan is probably a lot lower, and the re-tear rate is a little higher. But yeah, I like to tell people, I don't like to say they all have their good and bad. It just all depends on what you are looking for.
Yeah, I think it's a good synopsis. I think that it really, the main point is that there's no 100% right or 100% wrong answer here, which is kind of going to be a theme of a lot of these questions, unfortunately. That's, I think, why we get asked these questions so often, is that you can't just Google it and have the one answer.
Yeah.
And with grafts, just like all those other questions, it's about context. Mm-hmm. And if we think breaking it down into allograft, so a donor tissue versus autograft, your own tissue, like the kind of simple algorithm there would be, are you under 30 and do you hope to get into more higher level activities that might require some cutting, pivoting, basically any field sport, skiing, things like that? You probably aren't going to want to go with the allograft, the donor tissue, just because the re-tear rate is a bit higher. It comes from a cadaver, and there is questions about long-term viability. And if we break it down in autograft type, right, if you decide you do want to go do higher level activity, there's going to be pros and cons to each one, right? Like the hamstring is going to be maybe a little bit less painful in the short term, just because there's less trauma directly at the knee. But the downside is that it does seem like there maybe is a slightly higher re-tear rate, and honestly, getting that hamstring strength back after the graft it's hard. Right. It's a lot of work. And if you don't like working hamstrings already, and you know that before surgery, a hamstring graft might not be for you. Meanwhile, like the patella tendon, a little bit more pain immediately after surgery. And that's just because they're cutting more into the knee, which already has a pretty major surgery going on. Getting quad strength back is going to be a little slower than the hamstring, but I personally find that it does come back a little more reliably than the hamstring sometimes can for people. But if you had to say, I mean, Mica, what did you get for yours?
Yeah. So this, I've torn 3 times, had surgery 3 times. So I can walk you through all my life choices. So my first time tearing was at 16. So I didn't know I had an option. I didn't know of any of this at all. So I was just like, whatever the surgeon says. Pretty good soccer player, striker, So I definitely really needed my speed, something I didn't really factor in into my rehab process. But so I chose the hamstring. So I went with the hamstring, and around that time, hamstring was actually pretty big. A lot of surgeons use the technique. So I did the hamstring. I will say for me, yeah, absolutely. Like early phase for me was pretty easy. I would say later on through the phases was very difficult for me, just because even to this day, I feel like I have a hard time with my hamstring strength. I don't feel like I've ever really gotten to true 100%. I've really had to fight for it. And I think maybe I'm at close to 70% of my hamstring strength, which sucks. My second one, I went with an allograft. Definitely not the best choice for me. I didn't think that I would play still at the level that I was playing, and then continue on a lot further into my life. I mean, I did, but I didn't. I wasn't realistic. And so I tore that graft just earlier this, when did I tear? March?
Yeah, so about 2 months ago.
2 months ago.
Yeah.
Tore about 2 months ago.
You had a good run, though.
It had a good run. It lasted almost 11 years. So I was pretty happy with that.
That was also more of a trend back then,
Yes,
right?
it
Giving
absolutely
younger
was.
people
Younger people,
allografts.
yes, yes. And we're learning our lessons that it probably is definitely not the best option for younger people, because we are going to be reckless and we're going to be invincible until we tear it again. Yeah, and so then this third time I decided to do my own tissue and did patellar tendon. There was just a lot of things I needed to think about in terms of what I wanted to do. The patellar tendon is gold standard. We do see a lot of success with it, even though, you know, down later on the road, there's like 20 to 40% of the people who get patellar tendon that might go on to have some patellar tendon pain later down the road. But usually, you know, it's less than 5% of the people that have like go on further in their life that deal with this on a chronic level. So usually after 2 years, it really does get better, especially if you're one of those that are dealing with the pain. But as long as it's appropriately managed. But for me, I just felt like that's what I needed to do. There, you know, obviously is some risk to your tunnels widening a little bit. So I didn't want to take that risk with soft tissue being in there to just have that risk on my graft. So I decided patellar tendon just because of the bone attachments, which I felt would seal the deal for me.
Yeah, that all makes a ton of sense.
Yeah,
Right,
yeah.
those bone plugs on
Mhm,
either end of that patellar tendon that
Yeah.
they harvest
for sure.
do seem like they play a role in the extra stability and longevity and
Yeah.
resilience of the tissue. So
Mhm.
it all makes sense.
What graft type, if you were to go through it, what would you do?
And we have this conversation a lot, and I don't know if I haven't been put in that situation before, but having seen tons of people who have had to make the choice and seeing what the rehab looks like, it's a tough choice, but I think I would probably go patellar tendon. I think that just the difficulty getting hamstring strength back that I've seen some people go through, I think to me outweighs the risk of having knee pain with things like kneeling in the long term. So that is in the long term, that is other than like the minor difference in re-tear rate. Some people are going to have some patellar tendon pain, but usually that's just if you're someone who does like a lot of kneeling. So if, you know, I don't do yoga, I'm not, you know, an electrician or something where I'm always kneeling. I probably would go with the patellar tendon.
Yeah.
Yeah, those first couple of weeks and maybe month or two are a little bit tougher just with the pain, but the long term it's similar, and that's probably where I'd go.
Yeah, I do want to know, like, there's a couple other procedures that they are doing now as well, and they are termed LET procedure and the ALL procedure. Every surgical technique is different, and what they, you know, all of you as a team decide is best for you. But we generally do see in the research that the LET procedure is more effective in terms of helping reinforce with rotational stability than the ALL is. Both are good options, but it just all depends on your surgeon and the technique that is best for you. They typically will do it in people who are teens, early teens. So if you're like 12, 13, people who are still growing, people who need quite a bit of rotational stability, they are doing it now in the younger population, right off the bat. Not every surgeon will do that though, but most of them are starting to do it. The other thing is if you are a re-tear, so if you've only torn once and then you just tore yesterday, the likelihood that you will get an LET procedure is probably pretty likely at this point. Just because the risk for you to re-tear is a lot higher, and we just want to reinforce you as much as possible. So I did the LET procedure, and just a general synopsis of that is they go on, clip about 10 millimeters of your IT band, the bottom of your IT band, and pull it, and then loop it around your LCL, so the ligament on the outside of the knee, and then go back and reattach it with a staple. So, yeah, so I mean, it does contribute to a little bit more swelling, a little bit more discomfort on that side, but definitely helps with the instability that you have when you change direction, for sure.
And there is a detailed synopsis of the different graft types with some of the information that Mica shared on, like the LET, more of the what's going on with each graft, where are they harvesting from, these advantages and disadvantages, kind of all spelled out in the section in the roadmap in the community. If you go to the roadmap, and in the pre-op phase, there is a lesson about graft types. So if you have any other questions, check out that page. It lays it all out.
Yeah. Just know you guys have a choice. You guys have a choice. And if you don't like the option, go consult another surgeon and figure out what's best for you.
Yeah, it's context is important, is crucial.
Yeah,
I think all these answers.
I think, honestly, whatever graft type you choose, it's just really important how you rehab it. Is the biggest thing, and making sure you're rehabbing it well and progressing it well. Then you're going to be fine. Okay, should we move on to the next question?
Yeah, let's do it. So this one can be tricky, but it's one we get pretty regularly. It is about how much time you should plan on taking off work after surgery. And so Mica, you've kind of gone through this recently.
Yeah, I definitely went through this. I'm a go-getter just in general. So can be a good and a bad thing. I'm older this time. I'm healing a lot slower than I'd like to, which I can't do much about it. But I actually only took 1 week off of work. And if I could probably do it all over again, I would actually take 2 weeks off. I think mentally I needed to come back to work. Because it's just, you're distracted. You don't have to think about the suck that you're enduring at the time. But physically, I don't think my knee was ready. I swelled up like a balloon at the end of the day, each day, and tried to limit how much I was doing. And even though I tried my hardest to stay in a non-dependent position, it still wasn't very happy with me. So, it also depends on what you do for a living. Like if you work from home and have that luxury, great. Then honestly, probably take a week off. And so that way you're mentally and physically able to do what you need to do. If you're like a more physically demanding job, then we're talking maybe 2 weeks. But it all depends on what you do. Like if you're a nurse and your job requires you to move bodies over 80 pounds and things like that, and be up on your feet 12 hours a day, you're probably not going to be going back to work in 2 weeks. So it all depends on what your job description is. Yeah.
Mm-hmm. Yeah. This first stage, these first few weeks really sets you up for success in the long term, but also it really is about making sure that you're comfortable, right? And Mica experienced this, and she was good about following the non-weight bearing precautions, because you had the meniscus repair as well. But even just being at work and being in a position standing and sitting for an 8 or 10 hour day was probably too soon.
Oh, yeah.
And it resulted in, this is reasonable to say, like just more swelling and soreness for probably longer than you needed to deal with.
For sure.
And, she was in a situation where you had to take care of the patients that are on your caseload, and, people need help. And so you suffered through it a little bit more and kind of paid some of the consequences.
Yeah.
And so again, this is about where like context and your individual situation is crucial.
Yeah.
If you're a nurse and you work 3/12s, it's probably not going to be 2 weeks. You should probably plan on a month. And even then, it still might be tough to really feel comfortable after 3 shifts in a row. But if you have flexibility working from home, yeah, maybe after a week, if you have the flexibility to make sure every hour or two you can go elevate and kind of chill out a little bit, answer some emails laying down, then that would probably be fine. But even going into the office, right? If you work a desk job, that still might be tough. Just getting into the office, having to sit for 8 hours. Because with 1 week off, you're not going to be comfortable sitting for 8 hours straight. If you're having a commute, sitting at your desk all day, you can't really lay down and get your leg really elevated. It still is going to be tough. And so I would say, unless you have a really comfortable, chill situation with work where you can, take time to take care of yourself, 2 weeks would probably be ideal so that you're more comfortable, can actually get to the rehab stuff and not just continue irritating things. But 1 week is reasonable if you have some flexibility.
I think the other thing we need to consider is like, there's going to be some of you out there that have kids. That's a job in itself. And, I'm going to say this, you need to take care of yourself before you take care of your kids. I know that's very, very hard to hear. And you're like, but I have nobody. You probably do have quite a bit of social support. And if you don't, there's communities like this you can reach out to that I'm sure people would be willing to help you in some sort of way. The biggest thing, like Sam honed in on, was, the goal is to quiet things down as soon as possible instead of making them worse, because otherwise you are going to prolong your early recovery phase. So, if your kids are of age where they can absolutely help, I'm sure they would love to help. If not, incentivize it, something like that, where it's helping you so that way you can get to a point and be mom again and help them, mom or dad, whomever it might be, co-parenting, whatever it might be. That's just, I think, something that's often forgotten about the kids situation, because I don't have to deal with that. I have a dog. That was a little difficult, but same concept still applies.
Yeah, your husband gets an award for
He died.
best dog walker. Yeah.
Best dog walker.
Yeah, it really, this first stage in rehab, I always tell people it's the toughest. It is. I mean, the later stages are tough in different ways, but this first stage in rehab is challenging because you have the most pain, and you can't live your normal daily life. Like once you're at month 5 through 8, the challenge is different, right? You just feel like you're slowly making progress, building strength, but at least you're able to live your life and don't have a lot of pain. And so my goal for everybody is to try to do what they need to do to get this knee calmed down as quick as possible. Because if you can, after about a month or 6 weeks, your life goes back to feeling pretty normal. Like, yeah, you maybe can't go walk 4 miles, but you could probably go do your desk job, and you probably could go do your job as a nurse and be pretty fine if you actually give yourself the time off that you need to set yourself up for success. Versus saying, I don't have the vacation time, I'm just going to go back to work in a week. It would be kind of like saying, like if you were to sprain your ankle and say, it's pretty bad, but I'm just going to keep on playing basketball. And you just, instead of taking a week off from basketball, you just keep on irritating it and prolong it for 2 months when it could have been better in a week. So do what's right for you. Everybody has different life circumstances, but the sooner that you can get this tough stage of rehab over with, the better off you're going to be and happier you're really going to be. Does that all align with what your thoughts are?
For sure. Absolutely.
Yeah. Okay. And then this next question is, I think, the one that I get the most often, and it is, when can I do XYZ activity? And it could be, we get all sorts of things like roller skating, paddle boarding, yoga, hiking, horseback riding. They've gotten everything. And so we're not going to go into horseback riding or every activity, but just a few things that people oftentimes ask. let's just dive into some of those. So biking outdoors. When someone asks you, Mica, when can I go for a ride on my bike outside? What do you tell people?
Yeah, definitely not in the early phase, that's for sure. I'm a lot more comfortable with it. It all depends on what type of biker they are. But you know, around the 3 or 4 month mark is okay. Now, I don't know if me personally I would do it, just because the risk is still high. The likelihood that I will fall off a bike is probably pretty high. I just, for me, I'm not willing to take that risk. But you know, if it's a leisure ride with a very predictable ride, yeah, 3 or 4 months.
Yeah.
Mhm.
Yeah, that's kind of the similar thing that I
Yeah.
tell people is, if you are in a controlled situation and you're not clipping in,
Yeah.
3 months-ish is probably what I would say is what to plan for.
For sure.
And that doesn't mean biking through downtown Seattle or whatever city you're in, having to dodge cars, but a casual situation, 3 months is probably what I would recommend. And I also tell people that I probably wouldn't do that. You know, the likelihood, how often you fall off your bike, not that often. But at that 3 month mark, the graph that you have is still extremely immature. And an awkward fall, having to put your foot down in a weird way while moving, it could be enough to tip it over the edge. And so I personally wouldn't do it, but physiologically the tissues can handle you biking outside.
Mhm.
So 3 months is kind of a rough timeline for casual biking.
Yeah, do it with care and caution. That's what I
Definitely.
tell people.
Yeah.
And it's a little bit different story too, clipping in, like if you use cleats as well, that's a little more dicey in my opinion. Just in terms of how you're having to clip in and out, and how quickly as well, if you have to get out of a situation. Sometimes honestly you forget. I've forgotten multiple times that I'm clipped in and I fall over, and that's just a compromising position that you'd be putting yourself into. So
Yeah, if your foot's fixed,
Yep.
right? If your foot's fixed and you put your foot down and
Yep.
just maybe don't quite clip out right, even if you don't fall, like there is a twist there,
mhm,
which with this graph being immature, like,
Yeah.
is that enough to re-tear? Probably not, but there is, it's just a
could be,
stress
yeah,
that we
you
don't
don't want to
recommend
mess
messing
with.
with.
Yeah.
Yeah.
Mhm.
Yeah. What about swimming? And we're talking casual swimming. This isn't
Yeah,
like
yeah.
training for an Ironman.
Yeah.
This is like, I had this asked recently, actually. It was, hey, we had to postpone our trip to Hawaii because of this injury. When could I go back? When could I go to Hawaii and go snorkeling? You know, casually swimming, not going and swimming for miles.
Yeah, I think the thing that we need to think about, you know, there's a lot of benefit to water for ACL rehab too, but we have to off the bat just remember that early on it's just not appropriate, because we're trying to get the incision sites healed. There's risk for infection. Sometimes if you're getting into a pool, you don't know what's in there. If you're getting into a lake, you don't know what's in there. So it also could compromise that and cause an infection. But you know, I usually say, yeah, at least maybe the 3 month mark for a casual swim. Doesn't mean that you can do, like, you can go in and do some arm stuff if you wanted to, just not kick with your legs, stuff like that. It just all depends on your comfort level and your swimming level as well. But like if you're going to Hawaii and getting out into the ocean, you know, the biggest concern I have is getting into the ocean, just because sometimes you have a wake that comes through and it just totally can take you out. And that's, you know, you're on an uneven surface at that point in time and things could happen there. But usually when you're out there, I think it's okay. What about
Yeah.
you? Is that what?
Yeah, that sounds about what I'd recommend. I mean, there's no reason why once the incisions are healed after about a month or so, 6 weeks or so, why you couldn't use a buoy at your legs and then use the hand paddles and get some upper body work if you really love swimming for cardio. Sounds like it's a killer workout for someone that's not a swimmer. That would not be me after 6 weeks, but some people like doing that, and that's okay.
Yeah.
But it's going to be dependent on what you can tolerate, how proficient you are at swimming. Some people at 2-3 months are totally fine doing like a crawl stroke freestyle, and that's fine. You know, you can do some light lap swimming or go casual swimming in the lake or the ocean. But But definitely, one thing we didn't mention is stroke style, so no breaststroke. Like that's just going to be too much stress on the ACL with that rotational movement. For probably more like 5 months is a good cutoff. Some surgeons have very conservative guidelines there. We'll say like 6 even. But yeah, my biggest thing actually is, other than the no breaststroke, is getting in and out of the water.
Yeah.
I think people kind of forget, how when you're getting into the ocean, even a decent sized wave when the water's up to your thigh is enough to feel like, oh, I'm a little off balance. And when you're a month and a half out and don't have great balance and stability, that catching yourself when you can't see your feet, it can be sketchy. So
For sure.
that 3-month mark is probably when I would say, like, if you want to plan that trip to Hawaii, that's a safe bet for like you to get in the water, snorkel around, have some fun. But yeah, that's a good timeline.
Yeah, I think if you're going to a resort and wanting to jump into pools and stuff, I'd say no to that. Probably until you're maybe actually starting to jump in your rehab program. So if you're going to a resort anytime soon, just walk in the water until you're jumping.
Yeah, no
But
cannonballs.
no cannonballs yet. I think the other thing to think about too is for those of you that are fluent swimmers, when you are flip turning. If you're trying to learn how to flip turn, probably not the best time to learn. Just wait it out a little bit, maybe get closer to that 6-month mark at the very least. And sometimes just the push off in general just doesn't feel very good. So, play it by ear and see what your knee can tolerate. But the biggest thing is just making sure we're not adding to the problem.
100%. That's a good moral of the story for all these things. It's
Yeah.
like, even if we're given these timelines, and this is usually when we say 3 months for biking, 3 months for casual swimming, but it really is totally dependent on where you are in the process. And if you look through the roadmap and the rest of the ACL community that we've put together, we really harp on not following time-based approaches. And I know we are giving you some timelines here, but these aren't hard and fast rules. If you try doing some swimming and your knee, let's say you have the patella tendon graft, does not like that repeated extension at 3-4 months, and you do it and it's really sore afterwards, it doesn't mean that you're clear to do it, right? The more that we push into these things that cause this lingering irritation that we've got to recover from, the more it takes away from your ability to actually do the things that will progress you in your rehab. So these are all just general timeframes. But yeah, that's good on swimming. Tricky one is snowboarding and skiing. And they're different, right? There's different stresses on the knee. Skiing is a bit of a higher risk for people after an ACL tear. We don't see as many snowboarding ACL tears, but they do happen. I generally tell people, I treat it the same as when somebody is looking to get back to soccer, right? I mean, it's going to be a lot of stress on the knee in pretty much the positions where you re-tear, right? ACLs are most often torn at about 30 degrees of knee bend with a valgus movement, so with that knee slightly inside of the hip and foot. And if you're skiing, you're in that every single turn. And all it could take is a little bit of catching a little edge when you're in that turn to put too much force through the knee to tear, unfortunately. Now, usually a tear is from like a bigger fall than that, but it can happen, especially if you're looking to get back after 6 months, which is, I see a lot of people online on like forums saying, oh yeah, 6 months is when I was getting back to it. It's like, yeah, maybe you felt strong enough to do it, but that graft is just not mature to handle much stress.
No,
So
it's not healed for sure.
It's the same timeline, that 9 months plus passing all the return to sport testing, in my opinion.
No, I would absolutely agree. I think skiing there's just a lot of unpredictability. You don't know the type of snow that you're going to get into. Visibility. There's just a lot of factors. I definitely do what you do, Sam, and just stick to the minimum 9-month protocol. Just treat it as I would a soccer player for sure. It's just too risky to get back as soon as possible. I know it's super hard to miss out on your sport. But you just have to weigh the risks. Mhm.
And that still applies even if you are a beginner.
Mhm.
People will ask like, oh yeah, but I'm not like doing flips. I'm not hitting black diamonds. I'm not doing, mogully double blacks. Like, what if I'm just doing greens and some blues and I'm cautious? I think that's actually even more
I do,
concerning.
yes,
Right? If
yeah.
you're not super proficient in something, if you watch someone learn how to ski, they're falling a lot.
Yeah.
They're falling a lot. Those first couple of days aren't really fun.
No.
They don't seem fun, at least.
No.
And so each one of those falls until that graft is pretty mature is a risk. And so it's not the time to learn,
Mhm.
right? Just because you're not going fast doesn't mean that you're not at a risk of tearing. Each of those falls is sketchy.
Yeah, there's just a lot more room for error. A lot more room for error. Like I know when I was snowboarding after my first one, I fell so many times. I fell so many times, was terrified. You go fast. There's a lot of other people. I ran into somebody, so it's just, or I fall off the chairlift because I'm learning. So there's just a lot of room for error. Yeah.
So it still applies that 9 months plus passing return sport testing is really the standard, whether you're a beginner who's just slowly going down the greens, or if you're an expert.
Mhm.
Yeah. Okay. And then, like I said, we've gotten asked every question about when I can come back, when I can do XYZ activity. So we'll stick with just those few for right now. You can always ask on the feed, right? If you have a question about specific sports or activities, we're happy to answer. Just make sure you provide enough context and we can try to give you a little bit of some insight there. But what about when you can start going to the gym after your surgery?
Yeah. Honestly, as soon as you feel ready is what I tell people. The biggest thing is like the first week, sometimes you're not in a spot to go to the gym. You can barely function and get out of bed. So that's probably not the priority, but honestly, it all depends. Like somebody might be doing really well and that's what they can do. They could probably go like as soon as possible, honestly, and do their rehab there and or do some upper body stuff. Your arms are not broken, so there's a lot of things you actually can do. You can load up the other side that's not affected. There's just a lot of opportunity. I personally didn't go to my gym, probably. Obviously our work is a gym. So I guess I was here every day. But to my personal gym, I probably didn't show up there until about week 3. I just don't think for me, I was just tired. I honestly was physically tired by the end of the work week and drained and just really needed to focus on my basics. But I also mentally just wasn't ready to tackle that obstacle. So I dealt with a couple things there, but I went when I felt like I was emotionally and physically ready.
Yeah, people after going through prehab are feeling pretty good, right? We talked about prehab and how by the time they get to surgery, sometimes they're like, oh yeah, why do I even need the surgery? You're feeling good. And so people are going to underestimate maybe how much of a toll just having that surgery takes. And so, number one is like, when do you feel ready for it?
Mhm.
Day one, you probably shouldn't go to the gym day one because you're going to be, you just were on narcotics and you just were put under sedation. But technically you're just doing some bench press and some lat pull downs and doing things where you're not putting any stress on your leg. There's no chance of you re-tearing unless you're doing something really not smart. Just so we're clear though, when we say going back to the gym, we mean doing things not related to your injured leg, right? You should not be just hopping on the leg press week 1. Follow your PT's instructions. Don't mess with it. That doesn't mean you can't do, a leg press on your other leg as long as you can get your surgical leg out of the way. But be smart there.
For sure.
So once you feel up for it, I love for people to get back to activity as soon as they can.
Yeah.
The more exercise that you can get, the better, both from a physical standpoint, so you're not losing all of your muscle mass, but also the mental health standpoint, right? Just getting endorphins going, can make you feel better, which will also help you be a little bit more energized to do the work for your knee as well.
Yeah.
Yeah, there's tons of things you can do, not just upper body, but cardio options too.
Yeah, and I think we need to also make that point of, at some point in your rehab process, you should be getting to a gym. Just so that way you're appropriately loading 15-pound dumbbells. They're not going to carry you through your whole rehab process. So if you don't have a gym membership or don't have a facility like a PT facility that has the quality equipment that you need, go find one. And get on that, or invest for sure. Invest.
Yeah, you don't need everything that a gym has. We're not going to use every piece of equipment. It's nice to have options, partly for your sanity, so you're not just doing the same things over and over again. But you do need more than a set of 10s and 15s and some ankle weights.
Yep.
That's a non-negotiable. So if you want to get back to sports, then it means you either got to find a gym and make that a part of your routine, or it might be time to invest in some equipment for home, which you can do without breaking the bank. We can help you with that. Yeah. Sounds good. Well, then last question we've got planned here is about what things look like after discharge. So I'm sure you've gotten this. It's like, people are at month 8, getting close to discharge date, and the question comes up like, man, what should I be doing in the long term to minimize my risk of injury moving forward? And what are the steps there?
Yeah. I think the thing that I'd like to hone in on with this is that this is now a lifestyle change for you. This is your ACL injury and journey is going to be a part of you for the rest of your life. And your goal is to hopefully go through it once and only once. And, once rehab is over, it doesn't mean you stop whatever things that you learned how to do. All of the things that you were doing in your rehab to get you to the best athlete that you can ever be. I think it's important to use those tools beyond rehab. Does it mean that you have to train at the same intensity as you were probably doing in your rehab? Probably not. But, doing some leg extensions for sure a couple times a week, doing some overloading with some weights and stuff, I think is important. Working on your power, working on your speed, whatever it might be that you feel like, you definitely need for whatever sport you're doing. I think it's important to just stick to some sort of program. It doesn't have to be the same intensity, but definitely doing it a couple times a week for sure.
Yeah. Yeah, totally. I get that the reality is that even if you like to be active and like playing sports, it doesn't necessarily mean that you are a gym rat. I get it. And if you put in the hard work in your rehab to do your rehab right, you've had to have been pretty committed, and you've spent more time in the gym than you probably want to. And the reality is that that's what it takes to build out of the hole that you've kind of ended up in after the surgery and after the injury. Building takes a lot of work, especially when there's an injury associated with it. So it takes commitment. It takes getting to the gym, 3, 4, 5 days a week, doing what your PT prescribes for you. It doesn't need to be to that intensity forever. And it probably won't be unless you're a professional athlete. But, if you had to say, Mica, what would be the minimum that you would recommend someone continues with down the line after rehab?
Yeah.
If they want to keep on playing sports and make sure they're minimizing the chance of injury.
Yeah, I think, it all depends on context of like if you're, what season, all of those things. But I would say a minimum, like to at least maintain what you have, you should be doing at least 2 times a week for sure. If you're wanting to build, doing 3 or 4 times a week. If you want to keep on the trajectory that you're heading, great. But at least a minimum of 2 a week, I would say for sure. And varying it up a little bit in terms of like the intensity that you're training. Like you can't keep it lightweight, right? You can't keep it lightweight to just say you're doing it. You do have to load yourself a little bit with it too. Yeah.
100%. You going to yoga, where you hold a tree pose, which, gets a little quad burn. That's not gonna be enough.
No.
That's not how we maintain our strength. I agree. Like if we're talking bare minimum of what I would recommend for someone that wants to be active, we're not talking somebody that's highly competitive in their sport or wants to perform at an elite level, but wants to be able to go out and play soccer and make sure they're not at a super high risk. It would be 2 days a week doing some power focused work, right? Jumping, sprinting, cutting, things like that. Doesn't need to be a lot. It can be low volume, some power, and then some high load work, both for compound movements. That could be a squat, deadlift, Bulgarian split squat, and then definitely hitting some isolated work. So hamstrings, quads, glutes, calves. Make some of that in there twice a week. Even if you skip leg day, you can still work in an upper body day, a couple sets of some Bulgarian split squats and knee extensions, and some other combination of other exercises, a couple other days a week. Doesn't need to be a ton, but yeah, the whole process it takes commitment.
It does.
And it's
It does.
easy to get burned out.
Yeah, it totally is. I think the thing that I like to tell people is I give my clients a rehab break, to be honest. Usually every 6 weeks or so, just because, physically, sometimes it's absolutely needed where they just need to deload or something like that, where we lighten the load a little bit for them. And the intensity a little bit, or mentally they need it. They are just getting burnt out of doing range of motion every single day, doing their quad exercises every day, whatever it might be. Sometimes it's nice to just take a step away from your routine a little bit to prevent the burnout, because this is such a marathon. And you're going to be working at this for at least a year. Like, you've got to take a mental break sometimes, or a physical break. And I definitely would recommend that if you're not doing that.
Yeah, there's nothing wrong with taking a week break.
No.
You're not going to lose progress, and you might even actually see more progress, giving your body an opportunity to recover, right?
Yeah.
Both mentally, physically. Give your knee a chance to not be stressed out 4 days a week with the strength work. But I would hope that if you are working with a good PT who's discharging you appropriately, and you've passed all the return to sport tests, I would hope that you've been given a solid discharge program that meets you with where you're at. If you're looking to play Division I soccer, that discharge plan is going to look a lot different from someone who's 35 and just wants to, be able to play soccer once a week when his kids are in daycare, right? That person still needs to do something, and your PT should give you a program that meets you where you're at, but something needs to be done.
For sure.
Yeah, the risk is just too high for tearing, and
Yeah.
you only want to do this once.
Yes.
Yeah.
Only one time.
Yeah.
Yeah. So I think that's it for today. So thank you guys for watching this. We encourage you, if you're not already gone through, we would encourage you to just go through our outline, our roadmap to the phases of ACL rehab. On our platform, we're posting questions every single day, answering questions every other day. So if you have a question, go ahead and post it. That's what we're here for. We would rather you get information that is evidence-based and from an ACL rehab specialist instead of Facebook parents. So it's really important because your situation is unique, and we want to give you the best advice possible. So thanks for joining, and look out for our next webinar.
Yeah, good talking to you all.
Very good.
And meeting for all.